Hi everyone, it's Linda Esposito from Be Clear with Bronchiectasis. I just completed another video and I listened to it. I could hear my air conditioning in the background. So I turned it off. And if you see me sweating, that's why. But hello everyone. I hope you've been enjoying my YouTube videos. I think I have 65 of them. I've been doing them for over a year. I actually enjoy them now. It's hard to believe. At the beginning it was so stressful, but now it's a pleasure. It's a pleasure to share my ideas with you. So if you like what you see, please subscribe and also like the videos. Okay, let's get on. What are we talking about today? We are talking about postural drainage today, which is a technique to help clear the mucus out of our airway. So one of my favorite devices is this, and we will be talking about that. But first, let's just talk about postural drainage. Well, depending on where you go for your medical care, you might not have heard of it because some places, including National Jewish Health, and we often refer to them as being the gold standard, they do not like it because if you're putting your body in different positions, perhaps lying on your right, on your left, lying on your back, even supporting yourself in a bridge pose, which is something that I like to do, you could be increasing reflux. But I'm still going to show it to you because the truth is, for almost 2 years, I could not get stuff up. It was just, I don't have a lot to begin with, but I could feel something in there. And truthfully, by the afternoon, if I wasn't able to kind of clear my airways or at least exercise, I honestly didn't feel that well. I might even have gotten a little bit of a temperature in the past. So I did start experimenting with postural drainage, and it actually was happenstance because in the afternoon I would, after doing my airway clearance, my exercise, having lunch, working, meeting with clients, I would often rest for an hour and I'd get in bed, be propped up with pillows, and then to read a book and hopefully take a little snooze. And all of a sudden, I'd start coughing. I'd feel this congestion and stuff coming up. And then I realized it was postural drainage that was helping me. And so rather than just having this happen whenever, I decided to be more deliberate about it. And I researched, if you go online, you can find the different postural drainage positions. And sometimes they can correspond to where your bronchiectasis or your, I had a MAC infection, where your MAC infection is. So you might, what I'm saying is you might want to be in the proper position to clear that area. So remember, in the smaller bronchioles, there aren't any cough receptors. So we have to kind of work that mucus out towards the larger bronchi where there are cough receptors that can help us get that stuff out. And certainly using gravity can be very helpful. As I said, many places or some places will say, no postural drainage. But I find with old school respiratory therapists, they always talk about postural drainage. And certainly in the cystic fibrosis community, it seems to be a standard. Recently, Dr. Lomash from National Jewish Health, when he was giving a talk on bronchiectasis for the patients, he brought up postural drainage. He actually had a slide, and I'm like, whoa, I was so surprised. And he said, I know, people are going to say, reflux, but not everybody has reflux, he said. And they have the largest cystic fibrosis community. They're taking care of the most number of patients in, I guess, the United States. And many people use postural drainage. So I'm not saying I'm giving you permission to try it, but if you find that you're not productive or you feel like there's still stuff in there and you want to use gravity to help you, talk to your medical team. I'm an educator. I am not a clinician. So anything I share with you, it's really for educational purposes. So let's talk about this lovely pillow. How is this pillow different from all other pillows. It's filled with flax. So if you use this, now I'm going to see if I can get on my sofa. I didn't even try this out ahead of time, but just to show you, I usually do this on a hard surface, but you could also do it on your bed. And this is my favorite position. I will try different ones, but this is my favorite, where I'm pretty much putting my butt up on the bolster. And as you can see, it's not working very well on the sofa, but this is what we're going with right now. And then leaning back so that my head is lower than my lungs. So the position is like this. And in this position, I think you can see me. And in that position, sometimes I can use my OPEP device, and I use an aerobica. And sometimes I might just breathe on my own. And other times I might use what is called the autogenic drainage app. So we have postural drainage, and then we have an app on our phone called autogenic drainage. It's a wonderful app. Many of us love it. And then like a year ago, it stopped working. So I reached out to the software developer, Kevin, and I told him our situation, how it had stopped working for many of us. And he actually worked on it. He rewrote the software. It took a few months because I think he definitely has a full-time job. And last I looked, there was no way of even tipping him. In the past there was, but last I looked, there was not. So he just did it out of the kindness of his heart for our bronchiectasis community. So that's how I use this bolster. It's really helpful because if you pile up pillows, you're going to find that you slip and you slide. This bolster is made by Bean Products. It's online. Bean Products, I'm not in any way collaborating with them, but I just love it and wanted to share it with you. So thank you again. Take care. Like my video and follow me. And thank you. Be well. Bye-bye.